Hey y'all, it's Costa. I help people break the system to build a better future. Today, we're talking about how vaccination requirements could destroy long-term care. So I've worked in the long-term care industry for the past decade, and I want to help you better understand long-term care and the pivotal moment that we're facing as our largest generation begins utilizing long-term care. Vaccinating our workforce and client population is one of the easiest and most effective ways to fight this pandemic. However, if you've watched any of my previous videos, our workforce is at the brink of destruction. Due to uncompetitive wages, underfunded facilities, and a lack of job advancement, our once stable workforce is finding opportunity in new industries of service, and seniors are paying the ultimate price. The biggest problem with vaccine mandates for all staff within Medicare and Medicaid certified facilities is our crippling resources to serve our staff. You see, according to the American Healthcare Association and the National Center for Assisted Living, 94% of long-term care facilities are experiencing a staffing shortage. As you know, one of the greatest resources provided from long-term care is the availability of one person to care for another. If we don't have that staff available, we can't serve our clients. Point blank. Think about this, y'all. About 6 in 10 long-term care workers are in the bottom 2 wage quintiles for earners overall. That's the lowest paid 40% of workers, defined as those earning less than $30,000 in 2018. This is unsustainable and should be terrifying to you. If you're over the age of 65, there's a 70% chance that you'll need long-term care. If we don't have the workforce to accommodate these needs, our population will suffer. So I bet you're thinking, pay them more money, right? All you talk about on this channel is how expensive long-term care is. Let me explain the greatest issue here. Wages aren't set by business owners like me. They're set by state and federal programs that facilitate these services, Medicare and Medicaid. When they tell me you can have funding to hire caregivers at $12 an hour, I'm handcuffed to that amount. We aren't paying our workforce enough to sustain a healthy and happy life. Why would they continue to work for us? If they're hesitant about getting vaccinated, why would they think twice about leaving this profession? The simple answer is they wouldn't. I fully support vaccinations, masks, and protecting staff and clients. However, we desperately need to start showing these workers their value and their importance. Throughout this pandemic, we've seen every fault in facility-based care, where nearly 1/3 of all COVID-19 deaths occurred. We need action from state and federal lawmakers to improve conditions for our clients and our workers, but it cannot stop at vaccine requirements. If you're working in a facility or you have a loved one receiving care, I urge you to research and identify the ways we can improve this industry and demand reasonable working wages and overall standards for our industry. Change starts with us, and guys, it must start now.